Are we rolling?
Mm-hmm.
All right, we're rolling, Dr. Anolik. This is Dr. Anolik. I'm here at his office trying to look glam with no makeup on. Dr. Anolik has been saying for years, because I'm a sun lover and I try not to get in the sun, but I get in the sun anyway and I get tan.
Yeah.
And that leaves these hyperpigmented spots. I have to worry about like skin cancer and all of that. And my mom had squamous cell on her lip.
Yeah, it's a very common skin cancer. On the face, sun-exposed areas, squamous cell skin cancer, basal cell skin cancer, and the most worrisome one is melanoma.
Yeah.
That's one that is dangerous. You want that out right away.
And we're seeing that in younger and younger people like me.
It's true. It's true. And we ask all of our patients, regardless of whether they're getting cosmetic work done or not, just to make sure that they're using sunscreen and being careful. We do ask people not to be the cover of the Sports Illustrated swimsuit issue, but 3 times. So she's creating a challenge for us with sun exposure. But we can battle it back and make the skin look healthier. And I'm always going to look out for things that look suspicious.
And the Fraxel helps remove some of those layers that can start to turn, right?
Right. So that category laser is technically a resurfacing laser. Resurfacing builds up surface collagen and exfoliates. So fine lines and pores and texture can look better.
We like that.
But I also like that we're triggering an immune response, a natural response. Your body does start to recognize things that could be problematic, and it helps make the skin actually, I feel, be healthier.
Yeah.
So it's part of the reason why I want to use it on you.
And that's why I want to use it too. It has nothing to do with the wrinkles and fine lines.
I do think about sun damage as bringing out a few fundamental things, sometimes a few broken capillaries,
I have that.
some scattered brown spots.
I have that.
And then there's a weakening of the surface collagen quality.
I don't have
Barely.
that.
But that's why I want to look at those things with you today. So using something like a Fraxel laser makes a lot of sense. We might use something called a ruby laser to target some of the dark brown spots, and probably use something called a V-beam laser and an XLV laser to target some broken capillaries.
So I'm at 3 lasers.
Well, there were 3 issues.
I thought I was going to get off easy with one. Okay. And then the big question is, do any of those lasers hurt?
There's little pinches and snaps, but I've had these done and I'm a terrible patient. So.
Yeah.
And the laser that I'm using for resurfacing, the Fraxel, is fractional. So the beam of light hits the skin in little dots, almost like pixelated dots. That means the healing is much faster and the risks are very low because we're leaving behind some healthy, normal, untouched skin to rapidly heal an area. You're going to feel a cool glass and a tiny pinch. Here we go. Cool glass.
Oh,
You okay?
yeah. Nothing.
So I'm looking at these little red capillaries. They're so tiny on you, but they're there. Eliminating them means that the skin tone will look more even.
Yay. And now that I've done this, I'm going to recommit to making sure I have my sunblock on, even in the winter.
So there you are. Glass and a pinch. There's a spray and then a snap. It's a little more startling.
Okay, so this one.
But they're both for redness and capillaries. They just have different advantages.
Anticipation.
All
Okay.
right. Here's a spray and a snap starting now.
Spray and a snap.
Here's a little more.
Okay. A little startling. But so far, it's not painful. What is that expression? Something like, you must suffer for beauty.
Right.
I'm not
I don't like that
into-
idea. I don't either.
This is called numbing cream. And I'm positively bathing in it. I can't feel my face when I'm with you, but I love it. I love it.
This specifically is going to target the dark pigment, some of the sunspots that we're seeing scattered about on your face.
right.
So it will vaporize the pigment particles and help them go away.
right.
Pain-wise, it's a little snap on the skin, but very tolerable. And here's a snap.
Oh, that's not bad at all. Oh, not bad at all. And are they instantly vaporizing?
Yes.
Wow.
But because of that, because of the instant, it actually creates a little bit of a pink marker, a scab, that will heal over the course of 5 days. All right, one right on your nose.
Oh yeah, you see that one, right? Oh, oh, well the nose is more sensitive.
Some areas are.
This is the Fraxel itself.
We're moving on to the Fraxel itself. And you're going to feel a prickly rolling heat over the skin.
Prickly rolling heat. I love these descriptions. Okay.
Starting now. Are you okay?
That's nothing.
Thousands of pinpoints of heat are touching your skin and tricking the skin into a healing phase or a collagen production phase.
Wow.
Any sort of small lines will improve as you build the top layer of collagen. The lines that are right on the side, these smile lines over here, those are also like the forehead lines, that they are pronounced from the muscle movement and the smiling.
Yeah.
So those will always be reinforced, but you should always smile.
And those I don't worry about those.
You shouldn't.
That's like like worrying about an elbow or something.
You're right. The forehead actually can be a little more sensitive. This is when you can sing. But you grew up with a lot of sun.
A lot of sun.
Southern California, right?
Yep. This is very important to me. And it's important to do a total body skin check, which we've done.
In the past year, I've paused and taken 2 biopsies on the face and on the chest that they thought were sunspots, and it turned out they were melanoma.
Oh my God.
Yeah.
Well done. Well, here I am. All red.